I'm Megan Barkert, nurse practitioner, and I work in integrative medicine at Legacy. And today we're going to be talking about managing hormonal therapy symptoms for breast cancer survivors. So first, a little bit about what I do, integrative medicine. So it focuses on the whole person and body, physical, mental, emotional, and spiritual health. We use both conventional and complementary medicine that's evidence-based. And within oncology, there's a strong focus on symptom management, symptom prevention, and reducing risk of cancer recurrence. So in terms of common daily adverse effects from hormonal therapy, these are the ones that we're going to talk about today. And when I first see a patient in my clinic, especially who's coming in just to focus on the hormonal therapy symptoms, they've often Googled this and they've seen these or they've heard about them in groups or from friends. And most people are coming to me saying, I don't want to take these medicines. They're fearful of adverse effects. Understandably so, concerned about how they're going to affect their quality of life. And so a lot of what I'm there to do is give them tools, because there's a lot of them, and offer reassurance that there are so many ways that we can pivot and mitigate side effects and make these medications tolerable. So first of all, again, from that integrative medicine approach, and when we're talking about treating hormonal therapy symptoms, taking a holistic whole person approach is really integral. So specifically with certain symptoms like pain, insomnia, mood changes, weight gain, it really, really is beneficial to be thinking about the whole person and how we're going to take care of you as a person, not just the symptom. For example, there was a HOPE study that took postmenopausal women and had one group do twice weekly supervised resistance and strength training, plus moderate aerobic exercise for 150 minutes per week. And that group had improvement in pain associated with aromatase inhibitors and more weight loss than those receiving usual care. So when it comes to these symptoms, that holistic approach, lifestyle, including diet, exercise, stress management, really does matter. And I'll just take a moment in terms of aromatase inhibitors. We're talking about letrozole, anastrozole, exemestane, and then there's the separate class of tamoxifen that are also hormonal therapy used to reduce estrogen to reduce the risk of breast cancer recurrence. So when we're talking about hot flashes, so in my experience, it is the most common adverse effect that I see with patients on hormonal therapy and those who are going through menopause. It's thought to be due to a thermoregulatory dysfunction within the central nervous system due to an anti-estrogenic effect. And really all that means is that as our bodies lose estrogen, either naturally from menopause or medically from hormonal therapy or some combination of the both, our brains no longer regulate temperature as they should. In terms of ways that we can treat this, and when I'm thinking about complementary methods, the one that I use the most is acupuncture. I've found it to be quite effective for my patients. Others to consider, though, are hypnosis, mindfulness, as well as cognitive behavioral therapy. All of these really do need more research in terms of their efficacy. But one of the interesting things about these different treatment methods is that they can treat other symptoms of hormonal therapy as well. So for instance, cognitive behavioral therapy has been found very effective for insomnia. Acupuncture we know is very beneficial for pain, and mindfulness is a great tool for mood changes. And so when I'm looking at patients who have hot flashes and potentially one of these other symptoms, using one of these methods can become even more effective, knowing that I'm going to treat more than one issue. So I also wanted to talk about hot flashes and phytoestrogens. So phytoestrogens are estrogen that naturally occurs in food. Foods that include phytoestrogens are flaxseed, cruciferous vegetables have one form of phytoestrogens, soybeans, and edamame. And if you Google phytoestrogens and hot flashes, you will find info out there that says, oh no, you can't eat those, it's dangerous. That has been debunked. Research has found them to be safe. And there's some compelling studies that show that increasing your intake in phytoestrogens may also reduce hot flashes. In addition to that, there is some evidence, especially with edamame, showing the benefit of phytoestrogens in terms of protecting against cancer recurrence. So it's just another reason to include those in your diet. And then this is not evidence-based, this is more from my experience, but I've found if I help patients to avoid fluctuations in blood sugar. So by eating small, frequent meals, each containing a fat and a protein, and doing a high protein snack about 30 minutes before bed, I've had quite good success with reducing hot flashes for many of my patients. The idea being that those fluctuations in blood sugar may be just triggering the hot flashes. And naturally at night, our blood sugars do drop. So by doing that high protein snack before bed, for many people, it keeps that blood sugar more stable throughout the night. So supplements and hot flashes, big topic. So number one, and this goes for any supplements I'm discussing today, for patients who have a history of cancer, and especially for those who are in treatment for cancer, it is essential that their supplement list is evaluated by a provider or pharmacist who has a specialty in oncology and the necessary knowledge and experience on herb-drug interactions. For example, supplements often used for menopausal symptoms like DHEA, red clover, and maca do have the theoretical risk of increasing estrogen levels. So these are supplements that I don't recommend patients with a hormone receptor breast cancer or a history of that take on a regular basis. So it's really important that, regardless of the supplements I'm discussing today, that your list is evaluated by someone who has that experience. And then I wanted to mention probably the most popular or well-known supplement out there for hot flashes, black cohosh. Systemic reviews and meta-analyses have found it to be no more effective than placebo. So it's not one that I recommend patients use. In terms of the supplements I do use, the one that I've had the most success with is pycnogenol. It's made from French maritime tree bark. I would say about 50-50 of my patients, so about half of them, it really makes a difference in terms of their hot flashes. Others to consider are vitamin E, ashwagandha, chasteberry, and rhubarb root. Rhubarb root is the main component in a supplement often people might be familiar with as estrogen. So all of these can be considered. Specifically, I wanted to mention that with the vitamin E, you want to limit that to about 800 units or less, international units, because there are studies that have found it to have possible negative cardiovascular effects, including contributing to the risk of stroke. Um, all of these, though, and another trend in this talk is we need more studies. I think there's multiple reasons why these aren't well researched, but partially due to, pharmaceutical companies not being able to profit off of them. So, this is all mostly anecdotal in terms of what I've seen, and more studies are really needed. So when I've talked with patients about hot flashes, we've tried some of these complementary methods, especially like the acupuncture, tried some of the supplements and some of these other things we've talked about. And they're still having significant hot flashes, and it's really impacting their quality of life. This is the time when considering Western medicine is really needed to at least have the conversation. Most of the patients are coming to me because they do not want to take more Western medicine. They don't want to be on the Western medicine they're already on, which I completely empathize with. That said, sometimes a low dose of a medication can make a world of difference in terms of quality of life. So my first go-to is venlafaxine. The trade name of that is Effexor. So it's an antidepressant, an SNRI, so a selective norepinephrine reuptake inhibitor. There's also two other antidepressants that are well known in terms of their efficacy for hot flashes, which is citalopram, also known as Celexa, and acetalopram, known as Lexapro. So all of these have been found to be more effective than placebo at improving hot flashes for patients. And especially the Effexor I've had really good success with. And I use it at doses that are lower than it's usually used for symptoms like depression and anxiety, and therefore tends to be quite well tolerated. Other meds to consider, gabapentin, which is technically an anti-seizure drug, oxybutynin, which is also used for overactive bladder disease, And then new on the market within the last year is Veoza. So it's the first drug that's been developed specifically for hot flashes. To be honest, it's not one I've used much because since it's new, it's expensive. And so with that, usually insurance is going to require patients try and fail one other med first before it's going to get covered by insurance. And I'm usually successful with the first drug that I use, so I just really haven't had to use it up until now. So, like I said, in terms of making these medications tolerable, I think it's really important to start low, way lower, and taper slow, or I'm sorry, increase the dosing slowly to make it as tolerable as possible. Sometimes these medications might make people feel tired, so then take it at night. If it makes you, affects your sleep, take it in the morning. So there's a lot of little tricks like that that can really make a difference. And then other things to consider when picking a medication, other symptoms that patients might have, health conditions, drug interactions. My whole point here is we really have to carefully select these medications. And if we do it in a careful and thoughtful way, often, patients have such a better experience than those that are often reported to me in the past. So another huge area of symptoms are from hormonal therapy are vaginal symptoms and sexual dysfunction. So common complaints include vaginal dryness and discomfort, dyspareunia, also known as painful intercourse, reduced enjoyment and or interest in sexual activity. So when I'm starting with patients who have symptoms like vaginal dryness and irritation, I start by recommending using a daily vaginal moisturizing agent. And so here are some brands that I recommend. In addition to supplemental use of a vaginal lubricant for sexual intercourse, coconut oil is a great one, olive or almond oil, and then here's some other brands to consider. So as a starting place, just using these moisturizers and lubricants really can help. That said, one of the big reasons patients have vaginal dryness and discomfort and pain with intercourse is because of vaginal atrophy, which basically means that with the lack of estrogen, the walls of the vagina thin, and the vagina is no longer as supple as it once was. And if symptoms are persistent due to this atrophy, it's really necessary for many patients that we consider a vaginal estrogen. This can be shocking to patients because we've spent all this time talking about how we need to reduce your estrogen. We're putting you on these medications to reduce your estrogen, but research has found them to be quite safe. So when we do a low dose vaginal estrogen, it mostly stays at the vagina. So it's very, very little of it is systemically absorbed throughout the body. And research has found it to not be associated with an increased risk of breast cancer recurrence compared to those who aren't using them. So within oncology, it's readily used for patients with these symptoms. In addition to things like the dryness and discomfort and pain with intercourse, it also can help for issues like urinary issues like incontinence and also bladder infections. So it has a lot of wide uses that can really make a big difference for patients. In addition, I wanted to mention one less commonly discussed issue to the vagina with lack of estrogen is the change in the vaginal microbiome. So the vagina is full of bacteria and yeast and other little critters. I mean, your skin is covered in them, and their balance is super important in terms of our vaginal health. When estrogen is reduced in the vagina, that biome can become dysregulated, and you can end up with yeast and bacterial overgrowth, which can cause vaginitis, where you get, vaginal discharge, itching, irritation, etc. So in that case, I recommend patients either take a probiotic or eat foods that have natural probiotics in them, excuse me, like yogurt, kefir, kimchi, kombucha. And then a trick I love to use is boric acid powder. So you can get medical grade boric acid powder, insert it into a vegetable based capsule, and you insert it into the vagina at night. And it helps balance the pH of the vagina to a natural acidic environment. And in a more acidic environment, that helps balance out the yeast and bacteria. You can buy these pre-made, but they're insanely less expensive if you make them yourself. And then I just wanted to note, if you try these things and your symptoms persist, you really do need to have this evaluated further. For one, you can have a vaginal atrophic vaginitis where the itching and the irritation is actually due to the atrophy, not yeast or bacteria, and therefore we need to think about other treatments. So sexual dysfunction. So reduced enjoyment and or interest in sexual activity often has many causes and therefore can be less straightforward to treat. So for example, patients with breast cancer, additional factors that can play a role include changes in relationships during and after treatment, body image. Sexual dysfunction has also been associated with depression in breast cancer survivors. So again, this is just another one of those moments where that holistic approach really makes a difference, especially when it comes to sexual dysfunction. I'm thinking about mental health, sleep, diet, and exercise. All of this can really make a difference. Other areas to consider are individual and couples counseling, sex therapy, medications like bupropion, also known as Wellbutrin, and buspirone, also known as Buspar, are also often used, especially with issues with libido. And then this might seem counterproductive because I'm talking about how I use antidepressants to improve symptoms, but a side effect of antidepressants, including SSRIs, so selective serotonin reuptake inhibitors, and SNRIs like the Effexor, they can also cause sexual dysfunction. So that's also something I'm always thinking about, is that could be a contributor. But that is something that can be fixed, whether it's reducing the dose of the antidepressant, adding another medication like bupropion, or switching just to a different antidepressant, because some have more likelihood to cause those symptoms than others. And then at Legacy, we have many resources for vaginal symptoms and sexual dysfunction. So I'm always happy to see patients to discuss these issues at Integrative Medicine at Legacy. Pelvic wellness physical therapy is a wonderful tool, especially for patients with urinary symptoms, pelvic pain, and types of prolapse. And then we also have Dr. Melissa Moffat, a gynecological oncologist who sees patients for sexual health consults. She'll start vaginal estrogen, do an exam, etc. And then just last year at Legacy, we had a local sex therapist who did talks on sexual health for patients with cancer, and this is the link for those. So musculoskeletal pain. So this is also a common side effect of hormonal therapy, and also can be a complicated one because patients often can have underlying chronic pain conditions. And then there's other parts of treatment that affect pain, like recovering from surgery, radiation, chemotherapy. All of these things can contribute to pain. So as I mentioned with the HOPE study, exercise really made a difference for patients on aromatase inhibitors in terms of reducing their pain. So I'm always recommending that we consider starting with a small amount of low impact exercise, such as walking, riding an exercise bike, swimming. Super important though to start slow and go gradually. Even starting with as little as 5 minutes a day. If we start with small attainable goals, it gives us a boost in dopamine, it makes us feel better, and it just can start that process of helping with pain, but then also mood as well. Obviously checking with your providers to make sure you're good to go with those kinds of activities. Other methods that can be really helpful for pain include acupuncture, so duloxetine, also known as Cymbalta, which is an antidepressant, and topical pain relievers can be great, especially for smaller joints like the wrists and hands, including capsaicin, which is made from chilies, CBD, diclofenac, also known as Voltaren, and lidocaine gel, and all of these are over the counter. So in terms of supplements to consider, so I've had quite good success with sour or tart cherry juice. You can get it as an extract, but for whatever reason, the juice seems to work better for most of my patients. And it really can improve pain in my experience from hormonal therapy. I've also had success with turmeric, coenzyme Q10, glucosamine, chondroitin, and collagen. Yet again, these all need to be studied more thoroughly in terms of their benefit for pain associated with hormonal therapy. With all of, if I've tried many of these treatment options, we're not making improvement, or pain is still really impacting quality of life, I discuss with patients the importance of talking to medical oncology, as often what they'll do is a medication holiday, where they'll stop treatment, the hormonal therapy for about a month or so, and see, is the pain better? You know, is it gone? Is it improved? And if it is, then that tells us, well, gosh, the hormonal therapy is a significant factor in these symptoms. And in that case, they can switch to another aromatase inhibitor or from an AI to tamoxifen. And it's not, we don't really know why, but for whatever reason, when patients struggle with the first medication they're put on, the second often they do better with. So it's a really common tactic that's used, and it can be quite successful. So these symptoms associated with hormonal therapy, fatigue, insomnia, mood changes, and weight gain, they're really interrelated. So they're very connected to one another, and there are so many factors that complicate them. So this is just one example of how complicated this can get. I'm in no way going to explain this algorithm, but it's just an example of, you know, these are just some of the causes for fatigue within, you know, different health conditions that can contribute. And so when we're talking about treating fatigue, there are so many factors for us to consider in terms of taking a holistic approach. So in terms of starting, in terms of treatment for these symptoms, again, that individualized holistic approach. So it's so important, you know, I take time discussing with patients their needs, their goals, their health history, any factors that might be contributing to these symptoms. And I'm always thinking about how can I treat as many symptoms as possible. For instance, if we improve hot flashes and or pain, it often can improve sleep, and then that can improve symptoms like fatigue and mood. So often it's a matter of how do we get the ball rolling in the right direction, and then that can propel more improvement in terms of symptoms. And then when I'm thinking about treatments, you know, for instance, like I mentioned, venlafaxine or Effexor, that can improve hot flashes and mood, or acupuncture can be helpful with hot flashes and pain, and thereby sleep and fatigue. So there's lots of ways where we can tackle more than one of these at once. So vitamin D. So vitamin D is an essential uh, a vitamin for patients in treatment and those with a breast cancer history. So vitamin D deficiency and insufficiency, we know it contributes to fatigue and depressed mood. We get it naturally from our skin during sun exposure to sunlight, though in the Pacific Northwest, there is not enough sun here throughout the year. We also find it in foods such as fish, egg yolks, fortified milk, and cereals. It's known to be essential for bone health, immune health, muscle function, and brain cell activity. The reason I am talking about it today is because it's also been found to be protective against certain cancers, including breast and colorectal. This needs to be studied further, but there's some really compelling research. And more recently, studies showing that optimizing your vitamin D level for those who are doing chemotherapy, it may reduce the risk or severity of neuropathy, which is nerve pain that can happen with chemo. So when it comes to vitamin D supplementation, it's also essential for those on aromatase inhibitors because AIs are known to reduce bone density. And vitamin D, like we talked about, is essential for bone health. This is an issue with the AIs, not tamoxifen. But so for all, this is something that I think can affect lots of symptoms and help just prevent issues moving forward. So the Institute of Medicine recommends a daily dietary allowance of 600 international units up to 4,000 daily. That said, if you're deficient and we put you even on 4,000 units daily, you're not going to get to an optimal level. Within my field, I'm usually aiming between a blood level of 50 to 99. And so to get to that when you're deficient, usually requires a prescription dose. So my preference is to check a blood level to get a lab on vitamin D. So that's ideal, but unfortunately, insurance often won't cover this test. And so often what I do instead is put patients on a moderate to higher dose, like closer to 4,000 units, and then we plan to check a vitamin D sometime in the future. So from the moment of a cancer diagnosis, Obviously, it's very understandable to struggle with stress, depression, anxiety. These are all very common, and they contribute to other symptoms like insomnia, fatigue, pain, and more. So again, focusing on a holistic approach, including diet, exercise, and sleep, it really can help. And one of the interesting things in the research is that exercise has been shown to be as effective, if not more effective, than other treatments, including antidepressants for stress, depression, and anxiety. So it's really one of my beginning places is working on exercise and other lifestyle changes for patients. So when it comes to the biggest improvements with exercise, they've been found with higher intensities, but all levels of movement help. And I really, patients need to meet their body where they are and not do too much too fast. But the big message here is just that, exercise makes a difference. When we're talking about treating mood changes, psychotherapy, such as cognitive behavioral therapy, is also first line for treating mental health conditions like depression and anxiety. When patients are looking for a therapist, rapport is absolutely everything. I can't tell you how many times I've had patients say to me, therapy didn't work for me, it was pointless, it wasn't worth my time. And my first question is, did you like them? And usually the answer is either no or gosh, it just didn't feel that comfortable. So it's so important that you have a good relationship with your therapist. And so if possible, if patients are going to be on a wait list or they've made an appointment, it's 1 to 2 months away. Ideally, I recommend asking if patients can have a brief phone conversation with the therapist, because even in a few minutes, I feel like often you can tell whether there could be a good rapport there moving forward. Obviously, this day and age, there is a huge shortage of mental health providers in our communities. And so often it's a challenge for patients to find therapists. We've got lots of resources in terms of access to therapy. We have wonderful social workers who can help with that problem as well. And then where I work at the Healing Center at Legacy, we have the wonderful psychologist, Dr. Michelle Lee. So she does short-term work with patients, focusing primarily on coping and stress management due to the cancer diagnosis and treatment, things like fear of recurrence, etc. And then we also have free individualized and group art therapy through Legacy as well. So another area that can be really beneficial, especially for mood and fatigue, is mindfulness and meditation. Research has found it to be very beneficial for mental health. UCLA has some great short, free guided meditations. They're anywhere from about 3 to 10 minutes. So here's a link to those. So that's a great resource I'm giving patients on a regular basis. There's the Calm app people are often familiar with. It has offerings for meditation, sleep, and relaxation. Some of these are free and others do require a subscription. This is a simple exercise I call one breathing. And all you do is you breathe in, you breathe out through your nose slowly, and in your head you say the word one. It's just a simple way to try and ground yourself into the present, stop, persistent worry and thoughts that might be going on. And then at the Legacy Cancer Institute, we also have support groups. We have free classes for yoga, Tai Chi, Qigong, forest bathing, and many more. So lots of offerings there, and that's our link to that. So again, I'm starting with this holistic approach. I'm thinking about lifestyle, I'm thinking about sleep, I'm thinking about all these different topics. But for patients who have severe symptoms, again, medications are always on the table for me. Completely depends on what the patient wants to do. But for those that are really struggling, a low dose of an antidepressant, especially for symptoms of depression and anxiety, can really be beneficial. And when we're talking about anxiety, there's other drugs outside of antidepressants like propranolol, that's a beta blocker, hydroxyzine, that's an antihistamine. All of these can be really helpful tools for patients. All of these do require a prescription, though. The other benefit, which I know I've touched upon with antidepressants, is that they treat other symptoms. Like we talked about the Effexor, Celexa, Lexapro for hot flashes. The Cymbalta or duloxetine is a great drug for neuropathy or nerve pain, as well as for depression, anxiety, et cetera, et cetera. And Cymbalta is also a really great drug for chronic pain. We also have antidepressants that are first line for insomnia. So I am not one to push Western medications on folks, but when I see, especially multiple symptoms that we could be treating with one thing, I think it's something worth considering. Again, like I mentioned, side effects can be limited by starting out slow, careful selection of the drug, and changing the time of day it's taken if needed. And I really recommend close follow-up. When antidepressants are started by providers like in primary care, often they'll follow up in 4 to 6 weeks or even sometimes 8 weeks. I often will see patients in 1 to 2 weeks because when I am treating these symptoms, I'm dealing with a patient who they've been in treatment, they've had so many side effects from other parts of treatment. The last thing I want to do is have them have more side effects. So I think that close follow-up really makes a difference in terms of mitigating any problems and making it as tolerable as possible. There's a lot we can do to troubleshoot issues. So sleep, this is a huge issue for lots of my patients, especially those on hormonal therapy. So number one, I'm thinking about other conditions that might be impacting sleep. For instance, anxiety, chronic pain, obstructive sleep apnea, and restless leg. All of these are common contributors to issues with sleep. But that's on top of, hot flashes and pain from hormonal therapy affecting sleep. But I just wanted to mention a few other little tricks here in terms of things we can do to help with sleep. So, for instance, restless leg syndrome. Ferritin, which is a measure of iron stores, if we optimize your ferritin level, getting it above 80, often that takes away restless leg syndrome. I can't tell you how many patients I've had who are on medications for restless leg, their ferritin level has never been checked. We check it. We either, get them eating a high iron diet or add an iron supplement, and their restless leg is gone. So that's a pretty easy trick. Also, for those who have simple leg cramps, stretching legs twice a day, magnesium before bed, these things really make a difference, even though they seem so simple. I am also always thinking about other medications patients might be on that impact sleep, including steroids. Dexamethasone is a common one used during chemotherapy. Gabapentin is often used after surgery or for other side effects, and it can really impact sleep. The antidepressants and then opioids like hydrocodone and oxycodone, often used for surgery, all of these can have a negative impact on sleep. So the timing, dosing, et cetera, these are all things to consider. And then for most patients, environmental and behavioral changes will improve sleep. So that's something we're going to talk more about on the next slide. And then for those who come to me who have chronic sleep issues like insomnia, cognitive behavioral therapy is a wonderful tool offered usually through a sleep medicine department where they focus in on the ways that we can change thinking and behavior around sleep to help retrain the brain to have a better sleep-wake cycle. So sleep hygiene. So some of these are going to be more obvious than others, but when it comes to improving sleep quality, so regular exercise, a healthy, balanced diet, stress management, they really do matter. It's important to avoid moderate to high intensity exercise in the evenings. This will dramatically impact the sleep-wake cycle in terms of the brain just being more awake than we want it at the end of the day. It's important to minimize napping, caffeine, and alcohol. Ideally, alcohol wouldn't be consumed within 4 to 6 hours of sleep because it affects the sleep cycle. I would never tell a patient in treatment that they can't take a nap, but being thoughtful about napping, because again, that can impact it. And then as we age, we get more sensitive to caffeine. I've had those who the effects of caffeine will last 24 hours. So I would never take away coffee from someone, but doing a trial without caffeine or reduction in caffeine intake to see how it impacts your sleep is also something to consider. Super important to have a consistent bedtime and wake time, not sleeping in the mornings when you don't sleep well. And then helping cue the brain that it's time for bed with a routine before bed, such as dimming lights, avoiding screens for 1 to 2 hours before bed. You can have a cup of herbal tea, take a bath, anything that kind of is a routine for you that cues the brain that you're getting ready to go to bed. And then I would say the biggest one that patients often aren't aware of is reserving the bed for only sleep and sexual intimacy. So that means no reading in bed, using screens in bed. And I don't want patients to be awake in bed. We don't want the brain to associate the bed with wakefulness. So if patients are in bed and they're awake for 10 minutes or more, I recommend, if we're really working on it, get out of bed, go somewhere else. So, living room, wherever works for you. But you want to avoid screens and you don't even want to read a paper book. So we want to do something like meditate, stretch. You can listen to a relaxing podcast or relaxing music. Audiobooks are a great option. And then when you feel tired, return to the bed again. These tools, they take time, but the research has found making changes to sleep hygiene routines more effective than any medication on the market. So it really can make a difference. So sleep and supplements, super big topic. Again, research is pretty limited. In my experience, most supplements will help patients fall asleep if they do help at all, but they won't keep patients asleep. Those that I often will use for patients who are having more trouble falling asleep. So L-theanine, it's an amino acid derived from tea. Magnesium is a great one, very calming to take at bedtime. Most formulations of magnesium, like magnesium calm, are a natural laxative, which can be a great thing for those struggling with constipation. But if you have loose stool or diarrhea, not a good thing. So magnesium glycinate is a form of magnesium that does not have that same laxative effect. So for patients with diarrhea or loose stool, that can be a great option. I have lots of patients who swear by the benefits of marijuana or cannabis for sleep. The research is, again, limited and mixed. There are studies out there that show that cannabis may negatively affect sleep quality, while there are others saying it's beneficial. I tell patients, you can try it and see. There are other things we could talk about. Marijuana and treatment is a whole other topic, or it could be its own presentation. But I wouldn't say it's necessarily a bad thing to consider, but in my experience, it alone is not going to be the solution. And then for patients who are continuing to really struggle with sleep, there are medications that I use regularly. The two I use the most, hydroxyzine, which I mentioned for anxiety as well. It's an antihistamine. And then trazodone, which is an antidepressant, but it's used at lower doses. Both of these can be very helpful, and especially for patients who are in treatment. I'm not expecting patients in treatment to be doing all those sleep hygiene recommendations. So sometimes we just need them to sleep. And in that case, considering a medication is very worthwhile. So weight gain. So this is a big topic. So unfortunately, when we lose estrogen, the metabolism slows. And so weight gain is a common problem. So first of all, when I'm dealing with patients who are either in treatment or they're in the early stages of recovery, my first step is let's focus on weight maintenance. I don't think we should be jumping right to trying to lose weight. It's just too much to take on. So I have them focus on healthy eating, regular exercise. In terms of diet, we're looking at a whole food, plant-based diet, rich in colorful vegetables and fruits, whole grains, beans, and nuts. So just moving towards this plant-based diet with less processed foods often helps dramatically with weight maintenance because patients are consuming less high-calorie foods. And then if with time, weight loss is something patients are feeling more ready to take on, it's just important to be aware that usually it's going to take some significant dietary modifications and changes to exercise because unfortunately we're against a bit of an uphill battle with metabolism and how it changes with hormonal therapy. That said, it is doable for most, but it just, there's a lot of changes that are often necessary in terms of diet and exercise, and it's really individualized, and I work with patients on that. We're hearing more and more about medications for weight loss. There's many up and coming and being used a lot these days. That said, insurance coverage is a huge problem. So right now, what I'm seeing is if patients don't have a diabetes diagnosis, often these meds won't be covered. Though, primary care prescribes them, I often will refer to endocrinology or like a bariatric surgeon's office to discuss these options, and they can be a great tool. That said, I think it's a bit of a challenge right now in terms of insurance. And then I wanted to just mention some other resources at Legacy. So one, we have lovely dietitians who are wonderful helping with diet meal ideas, helping with weight maintenance, weight loss, and weight gain. Speech therapy is also a wonderful tool. So one symptom we didn't talk about is slowed cognition. So that can happen where patients, things aren't coming to them as readily. There's some word finding, and speech therapy has some wonderful tools to help with that. Those symptoms often, in my experience, will improve with time and working on some of the other things that we've discussed as well. Physical therapy can be a wonderful resource in terms of regaining strength and mobility, especially if patients are coming out of treatment. You don't want to take on too much too fast in terms of exercise, and they can be great in terms of coming up with an exercise plan and a starting place in terms of reconditioning after treatment. We also have a clinical pharmacist on staff, another great resource to look at patients' medications list and look for any other factors from their medications that might be contributing to symptoms associated with hormonal therapy. And then I wanted to also highlight the importance of primary care. A lot of my patients, it's really common for primary care to not be involved much during treatment because there are so many specialists taking care of you. And so, primary care kind of just takes a step back. It's so important to reestablish with primary care, or if you're not established, get a primary care, especially as treatment is coming to an end, because there are a lot of health conditions that can contribute to the symptoms that we were discussing, including thyroid dysfunction, diabetes, uncontrolled hypertension or high blood pressure, chronic pain, and more. And not only can these symptoms contribute to or these issues contribute to the symptoms from hormonal therapy, these are also disease processes that can present due to treatment itself. So it's super important to have a primary care who's involved in your treatment team and looking for these kinds of problems. And that is my talk. Thank you so much. And I have my resources here, and I'm happy to take questions.